Immediately into surgery. Our plastic surgeon, Dr. Sandin, just did an amazing brow lift and eyelid surgery. So you could see basically just a little bit of swelling, almost no bruising, and sutures are in place. You could see them hidden in the hairline as well as in the upper eyelid crease and inside the eye. Now we're doing our laser resurfacing. So this is our tight and bright, and the cool thing is you could do this treatment while under anesthesia or awake in the office. But because he had his eyelids done, why not get laser at the same time, get the overall full rejuvenation done? So we're working right now on his forehead with our CO2 resurfacing, and then we're gonna go around his eyes. You can see the eye shields are in place. These are from Innovative Optics. We actually helped make these internal shields with them. These are actually curved internal shields. Most of them are actually straight. These curved ones cover the cornea more specifically in 360 degrees so that it's less likely you will get any corneal abrasion or any corneal trauma when you do eyelid laser. So if you guys are a provider out there, go to Innovative Optics. So now, yeah, go ahead.
Let's say, Dr. Sandin, do you want to grab your before photos and show us what you did?
That would be great.
Yes.
Do we have them? See if we got them so you could see. What was his goal, you guys? His goal was anti-aging and rejuvenation because he's hitting that middle age.
So is this ablative or non-ablative? This is ablative, guys. Dr. Sand's going to show us what we did.
So this is where we started this morning. His eyebrows in the middle and the corner, look how low they are in the middle. So even though he's a young, vibrant person, he always was being told he looked tired and angry. So we did an endoscopic brow lift. The incisions are hidden in the hairline. There's a couple up in the hairline. You can't even tell, honestly.
So tell them what endoscopic is, because they might not understand what that is.
So endoscopic brow lift means it's minimally invasive brow lift. I use a camera to clearly dissect in the appropriate plane, lifting up the skin and the muscle of the forehead away from the bone, and I lift it up in a very minimally invasive way, so it's very gentle on the skin. You can tell it's barely bruised, and you can't even see the incisions, and they're two corner incisions. I lifted the brow centrally and on the corner to make it higher, but also more horizontal. As you can see before, very downturn, and now you can tell that the middle of the brow is lifted.
And that's really important, you guys, for males. A lot of men are very nervous about brow lifts. They see surgeries that were done 20 years ago by some major celebrities that look very different. They look like a shock and awe look, and they have like pulled brows. That's not what we're trying to do here. We're trying to create a natural lift so that he can have better vision as he gets older. His brows won't fall as quickly, and there'll be more of his natural shaping that we want, that horizontal, masculine, rugged look, which is the look he's actually going for.
Can the laser burn the hair follicles off?
No, it can burn the follicle that's there. We actually feather into the hairline, and you guys can see, look, it didn't burn it. So it will not harm the follicle.
And then the other things that we did, you can see in the photo, his brows are low, but look, it's got a lot of extra eyelid skin. So we have to lift the brows and then remove some of that extra eyelid skin and treat the under eye fat bags. So this is gonna be really nice upper 1/3 facial rejuvenation surgically, and then full face and neck with the laser.
So that's what we're gonna do right now. So it's very important when you guys are doing lifting surgery to combine the lasers. And I'm gonna do a little bit here in the eyes and then finish the rest of the face so you guys can see. So the lower portion of the eye is where people notice a lot of their sagging and the hooding in the upper portion. So what we're gonna do to find wrinkles.
People want to know, so how much is high def 360 lipo for men? It really depends on what your starting point is and what your goal is. The cost varies. We have Dr. Emer and Dr. Rojas that do it as well, so you guys need to consult with us. Send us a DM, full name, email, phone number. Let's know about doing Morpheus 8 as well. Yes, we just did it before. It's how we layer our treatments. We're going to do our microneedle RF first, then our most aggressive lasers at the end.
You guys can see we have metal shields in here protecting his eyes.
Dr. Emer, can you tell us about the skincare protocol for the surgery?
Yes, we have
surgery scars and the laser.
Very detailed skincare protocol, especially for the eyelids. He's going to be using our peptides and our stem cells for recovery, an enzymatic cleanser, as well as a very strong silicone-based regenerative scar gel as well. See the tightening here?
Will his face be sore and burnt afterwards?
Yes, it will feel like a sunburn, guys.
So wants to know about permanent lip filler.
Well, there is none.
There is none, guys. Lip lift is the best option. If you're going to do silicone, it's going to look irregular.
Well, there are permanent implants that can be used, but permanent fillers in the lips never look really good.
So my opinion is it's better to get fillers there that you can reverse or do a little bit of fat and then fillers. Personally, I like the fillers nowadays. They're way more elegant than what we used to have in the old days. And I wouldn't do a permanent
People are
filler
asking
anymore.
about Bellafill in the lips. We do not put Bellafill in the lips.
I don't
No.
want that there.
You see, so periocular rejuvenation. And the protocol afterwards is going to be for him to do hyperbaric therapy, oxygen facials, and use our skincare. This is going to allow him to heal much more quickly. If you're not around us and you're unable to get those treatments done, we can get you them. Just let us know.
Is this one of the most aggressive lasers for acne scars? This is one of the most aggressive lasers. We do have several aggressive lasers at our office. This is going to be one of them. We both have deep smile lines. We can either use some filler there. We can do several microneedling treatments, or you can do a deep plane facelift, which will pull those lines a lot tighter.
And a common issue is blepharitis when you don't do the laser properly. You hit the edge or you don't do the proper skincare. So it's really important.
Is this the CO2? Yes, it's the CO2. What setting is the laser on? You guys know we're not going to tell you that.
And even if I were to tell you, the way I'm doing it is unique. There's a specific overlap here and a specific number of passes. You wouldn't even be able to replicate. Okay, so that's our.
We're going to continue on to the rest of the face. We're going to do the neck. It's very important to not neglect the neck. That area does get a lot of sun exposure.
Exactly. So now we're going to continue with the rest of the face and continue our rejuvenation treatment. So that's our periocular rejuvenation, you guys. Combination of plastic surgery plus cosmetic laser. I think that's the best combination. Now a third sort of trifecta approach would be to add filler or some sort of volume, whether it's fat injections, filler, or a Nuva synthetic fat. You can get an even more bigger improvement in that area. So again, if you guys have any questions about that trifecta treatment, come in and see us. Bye, guys.
Bye.
You can keep going if you want. But
Let's keep going for a little bit. Yeah, people will keep joining.
All right, well, if you have any questions, we're going to continue.
For those that are new here, we have Dr. Santa. He just did a endoscopic brow lift, did an upper lower blepharoplasty. Let's give all the new people, Dr. Santa, tell them about what you did.
Okay, so we did an endoscopic brow lift. What does that mean? Endoscope is a video camera, so it's a minimally invasive procedure.
We use that big screen behind you. It displays on there.
Yeah, so this is the screen that we use. So we have a camera that lets me see the anatomy very clearly, and then I have my dissection tool in my other hand. I'm able to lift your middle brow and the corner brow with an endoscopic brow lift, so it opens up your eyes and makes you look less tired, makes you look natural. That's the key. You're not going to look overpulled and surprised, which is what we want
Can
for men.
we talk about his before photo and why he needed it?
So this is his before photo. You can see a couple things. I drew the arrows to show the vector that we want to pull the brows in. The central brow is very low. It gives him like an angry and tired look. The corner of the brow is also downturned, so that is a sign of aging. So we did incisions on the corners and up in the hairline. It's as like scarless and incisionless as possible. And then he has extra eyelid skin, which we treated with an upper blepharoplasty, and he has some under eye fat bags, which I use the fat and I transpose it. What that means is I don't cut the fat out. I push the fat from the under eye down into the cheek, so it acts like a natural filler.
All right, and I think we have the tissue. Let me show you guys over here. You guys can see the tissue from the eyelids and the fat bags that we did remove.
So it's very important to be very meticulous in how you place this Also, just for people who understand lasers or don't understand lasers, the jawline below, there's a dramatic change in in the thickness of the dermis, so it's very important to change your settings or do a different type of approach from the neck jawline below. That's why.
Doctor,
What?
I was gonna say, can you tell us about the importance of doing anti-aging lasers while doing anti-aging surgeries?
Yeah, so I mean, that's our entire Instagram, you guys. We're always doing preventative treatments, and we're always doing treatments for overall rejuvenation. Hold on.
Your opinion on exosomes?
Love them, you guys. And I have just launched the anti-age exosomes in Dubai, and we will be using them here as well in recovery for him. So we'll show you guys that when we do a live oxygen facial tomorrow. Exosomes mixed with PRP and stem cells is the best approach for healing of the skin at this current time. Remember, he's got metal shields in protecting his eyes. You cannot perform this procedure without them. So this is still considered a preventative treatment for him, even though he is reversing some of the sagging that's occurring with age. He's young. So this is going to give him a reversal plus a prevention with a lot of the rejuvenation that he's going to get from laser especially. All right, I think that's good. So we will show you guys results in the next few days to keep paying attention. We want to show you his aftercare when he is here tomorrow. Bye, guys.